Hi, my name is Diane Caluzzi, and I'd like to ask Beth a few questions. My background is I have been 8 years fighting cancer, but the main thing about that is I've had to navigate cancer a different way than most people because my background, I've had 35 years in healthcare, and I've worked for hospitals, not-for-profit hospitals. I've worked for the Gallup poll doing healthcare research. I've worked for every single major hospital in Orange County, and I've worked in insurance companies and various other things. My question is, I've had to suffer quite a bit because I couldn't get health insurance. After my COBRA ran out, my own insurance company that I worked for as an executive tried to send me, they sent me a letter that said I was no longer on their plan, which left me uninsurable and without any kind of resources. I've spent my life dedicated to healthcare and its issues, and here I am faced with medical bills rising and no way to pay them, and I'm scared, and I think there are a lot of other people out there that are scared. My father has Alzheimer's. There's no end in sight. I really like Beth to come and fight for me in Congress and to tell people that I'm not asking for a handout. I'm not asking for socialized medicine. I'm just asking for a chance to pay my bills.
Thank you for your question, Diane. You have a lot of courage to share your own personal story about your health issues, and I thank you for that. I understand something about the importance of being a good advocate because I myself have a husband who has a neurologic disability. And I tell people that sometimes those big hands that you think are going to be there to support you in your moment of need become the giant hands that are about to push you over the edge when you're standing on the brink. Listening to your story, thinking about all of the people here in America who believe they are going to have the resources that they need should they ever face a chronic illness. It's very frustrating to see how our health system has become focused on the bureaucracy, has become focused on the profiteering, and has lost its essence, which is that this is a system designed to ensure that people have the medical care that they need when they need it. We really shouldn't have a healthcare system in which people can be excluded based on a pre-existing condition, in which policies can be rescinded arbitrarily. And you know, what's most cynical about that is that one tends to think that the insurance industry believes, and sometimes rightfully so, that people will be too weak, too tired, or too overwhelmed to even fight for their rights in this situation. To be a great nation, we have to do better than that. I disagree with those people who say that health care is not an issue for everybody in America, that Americans don't want to see reform in health care. That's simply not true. This is something which touches everybody's life, and while we invest billions and billions of dollars in homeland security and other types of security, let's face it, if you don't have health security, when you need health care for a child, for an aging parent, or for yourself, what else really matters? So when I go to Washington, I look forward to being part of moving this health care issue forward. It's very important that we not abandon the American people, because at the end of the day, your health care decision should not be based on the actuarials of an insurance company. It should be based on what you need. And when you need medicine, you shouldn't have to make a choice between your rent or the medicine or food. And you shouldn't be facing bankruptcy because you had the misfortune of getting a challenging disease for which those medications are very expensive. So if we want to be a great nation, and I believe we are a great nation, but to assert just how great a nation we are, we have to join with every other developed nation in ensuring that people have access to quality health care, and that when you have a serious challenge, you also have the resources available to meet those challenges, especially when you've worked all your life, when you've paid your premiums, when you have operated on the assumption that you've lived up to your end of the bargain. You should not have a system that tells you when you need it most that they don't care about you. So thank you for your question, and I hope I'll see you on the campaign trail.